Pulmonary embolism, a life-threatening emergency. So, in an introduction, we are going to talk on a detail of the pulmonary embolism. A critically and a potentially life-threatening condition, PE, that is a pulmonary embolism, is a sudden blockage of a pulmonary artery, usually caused by a blood clot that travels from deep vein in the leg, that is a DVT, deep vein thrombosis. It's a major cause of morbidity and mortality worldwide, requiring urgent diagnosis and management or treatment. So let's start with the pathophysiology. Pulmonary embolism occurs due to venous thromboembolism, that is VTA, where a clot, that is a thrombus, dislodge and travel to the pulmonary circulation leads to obstruction of blood flow, increased pulmonary vascular resistance, right ventricular strain, that is in the right side of the heart, potential leading to acute right heart failure, hypoxia and ventilation perfusion mismatch, worsening oxygenation. In severe cases, pulmonary embolism (PE) can cause hemodynamic instability and cardiac arrest. So let's talk about the risk factor for pulmonary embolism. It includes varicose triad, that is a venous stasis, hypercoagulability, endothelial injury, prolonged immobility like hospitalization, long flight travel, and also in paralysis, surgery, trauma, or malignancy, pregnancy, hormonal therapy like oral contraceptive, HRT, inherited thrombophilia, factor V, leading protein CS deficiency. Now, in clinical presentation, symptoms may vary but commonly include sudden onset of dyspnea, that is a shortness of breath, pleuritic chest pain, which could be sharp, worse with breathing, tachycardia, and palpitation. Cough with or without hemoptysis, syncopal or dizziness in massive pulmonary embolism. Sign on physical examination. There is a tachypnea, which is more than 20 breaths per minute. Hypoxia means low oxygen saturation. Sign of deep vein thrombosis like unilateral leg swelling, pain, redness, hypotension and shock in severe cases. So now let's talk about the diagnosis. Timely diagnosis is crucial. The following approach is recommended. First is a clinical probability assessment CPA, well score for pulmonary embolism, which shows high, moderate or low probability. PERC, pulmonary embolism rule out criteria for low risk cases. Now, in laboratory test, D dimer, which was seen in COVID, highly sensitive but not specific, useful in ruling out PE in low risk patient. Imaging, CT, pulmonary angiography, it is called a CTPA. It is a gold standard for diagnosis. Ventilation perfusion, that is V by Q scan, used when CTPA is contraindicated, like renal impairment, contrast allergy. Lower lobe Doppler ultrasound to detect deep vein thrombosis, that is DVT. If suspected, additional test ECG may show sinus tachycardia, S1Q3 T3 pattern in massive pulmonary embolism. Echocardiography, right heart strain in massive pulmonary embolism. Now, let's start with management and treatment. First is the initial stabilization by giving oxygen therapy for hypoxia, IV fluid if hypotensive, cautiously to avoid right heart overload. Vasopressor like noradrenaline in shock, anticoagulant, which is a mainstay of the treatment, unfractionated heparin UFH in unstable patients, low molecular weight heparin LMWH, enoxaparin for stable patients, direct oral anticoagulant, that is DOACS, rivaroxaban, apixaban, preferred for long-term therapy. Warfarin used less frequently now. Thrombolysis for massive pulmonary embolism with shock. Alteplase TPA in high risk cases to dissolve clots. In surgical management, surgical or catheter based intervention, embolectomy in life threatening pulmonary embolism, inferior vena cava, that is IVC, filter for a patient with recurrent pulmonary embolism despite giving anticoagulant, and in prevention, deep vein thrombosis, prophylaxis in high risk patient, low molecular weight heparin, compression stocking, early mobilization, avoid prolonged immobility, frequent movement on leg on long journeys like flights, central control risk factor. stop smoking, manage obesity, avoid unnecessary hormonal therapy, and last, in the conclusion, pulmonary embolism, a medical emergency that requires early recognition and prompt management. With advancement in diagnostic and treatment, survival rate